Edward and Alfred. Welcome to the show. It's Edward and Alfred. They'll keep you in the know.
Now we're going to go to our segment 2, which is the segment where we interview someone in the news or someone making news around the area. And so we've got in the studio Elizabeth Hosey, and she is the spokesperson, I guess also the main person with Mississippi Patient Voices. And welcome back to the program, Elizabeth.
Good day, Edward. Thanks for having me.
Well, Elizabeth, you did a program last Saturday in Gulfport for Mississippi Patient Voices, which is an educational expo for people to find out information. It's an educational program to let people know about the Mississippi medical marijuana program, right? And so how was it? Was it a success?
It was a great, successful event. We certified around 170 patients that day, and then we had an additional 30 patients come out who just wanted to meet cultivators and processors and learn more about who makes their medicine, and it was a really great day.
So 170 people certified. What does that mean to become certified?
Well, it means that they have one of the qualifying conditions, which makes them eligible for the medical marijuana program. And so a lot of the patients that we see, they otherwise can't afford to just go see a doctor because insurance doesn't typically cover your medical marijuana provider unless your general practitioner is your medical marijuana provider. There might be some relief there, but otherwise, you have to go pay a doctor to get that yearly certification. Sometimes it's a 6-month certification. And so our program is designed to help people access the program who would not otherwise be able to.
Do the doctors in general prescribe marijuana? Let's say your average doctor that you'll find anywhere, can they prescribe marijuana, or is it only a specific type of doctor that can prescribe it?
It doesn't have to be a specific doctor per se, but if you want to do it in Mississippi, you have to become licensed with the Mississippi Department of Health so that you are a registered licensed certifying practitioner. Now, this could be a doctor, it could be a nurse practitioner who's operating under a doctor. However, most doctors don't learn anything about medical marijuana when they're in school. Only some doctors who've sought out that additional education really know about medical marijuana and how it can help. And one of our lead doctors in the state who's really championing this program has a history with treating patients with opioids. And for him, he's just seen this miraculous benefit for people who can transition off of their opioids onto medical cannabis.
When you talk about the safety of the individual, opioids are so dangerous because they're addictive, and everything. And I mean, so many people lose their lives, they become addicted to opioids and such as that. It seems to me something natural like cannabis would be such a better way to go. I mean, if it's going to treat people in a natural way like that instead of getting hooked on some terrible chemical,
Yeah, that is, the safety of medical marijuana is one of the most important factors that anyone should consider when trying to evaluate or think about getting on medical marijuana. The way that medical marijuana works is that it interacts with our body's natural system called the endocannabinoid system, which acts like a thermometer or a thermostat for your body. If you're in too much pain, adding additional cannabinoids through medical marijuana can help turn that pain down. Alternatively, if you are, having untreatable nausea or vomiting, that medical cannabis can, move the dial a little bit and help you move out of that. Similarly with a panic attack, people who have PTSD or having a panic attack, they can find acute relief from that product. And I'll tell you why it's so safe is that your brain stem has a limited number of cannabinoid receptors. Medical marijuana is only a partial agonist, which means it just nudges those receptors to come on. As opposed to alcohol or pharmaceutical drugs, they are full agonists and they attack your brainstem directly. So that's why people can stop breathing and overdose from pills and alcohol, is because it directly attacks the brainstem, which controls breathing and other life-maintaining functions in your body. And so that's why medical marijuana cannot, or any cannabis really, cannot physiologically cause fatal overdose. You can use too much and feel unpleasant, but that's about it.
And Edward and Alfred, welcome to the show. It's Edward and Alfred. They'll keep you in the know.